EMDR stands for Eye Movement Desensitization and Reprocessing. It is a powerful therapy that helps people heal from trauma. Trauma can come from many sources, including car accidents, natural disasters, and violence. EMDR is different from other therapies because it does not require you to talk in detail about the trauma. Instead, it focuses on changing how the brain processes traumatic memories. These memories can get stuck in the brain and cause distress. EMDR helps to unlock these memories, allowing the brain to process them properly. When this happens, the memories become less distressing. EMDR has a high success rate, and many people experience significant relief after just a few sessions. This therapy is recognized as effective by the American Psychiatric Association and the World Health Organization. EMDR offers hope for those who have suffered from trauma. EMDR is based on a model called Adaptive Information Processing, or AIP. This model explains how our brains process experiences. When something traumatic happens, the memory can get stuck and doesn't get processed like normal memories. EMDR uses bilateral stimulation to unlock these memories. This usually involves following the therapist's fingers with your eyes, but other forms of stimulation include tapping or listening to alternating tones. These movements help to activate both sides of the brain. This bilateral stimulation is thought to mimic REM sleep, during which our brains process emotions and memories. By mimicking this process, EMDR helps to reprocess the traumatic memory, allowing it to become integrated into a person's life story in a healthy way. EMDR therapy follows a structured 8-phase approach, with each phase having a specific purpose. The therapist guides the patient through each phase. First is history and treatment planning, where the therapist gathers information about the patient's history and develops a treatment plan. Next is preparation, where the therapist teaches the patient coping skills and explains how EMDR works. In the assessment phase, the therapist helps the patient identify the specific memory to target and the negative beliefs and emotions associated with the trauma. During desensitization, the patient focuses on the traumatic memory while engaging in bilateral stimulation to reduce the intensity of the emotions associated with the memory. Installation involves the therapist helping the patient to install positive beliefs to replace the negative ones associated with the trauma. In the body scan phase, the patient brings awareness to their body and notices any remaining tension or discomfort. Closure ensures the patient is in a stable and grounded state before ending the session. Finally, re-evaluation involves the therapist checking in with the patient about their progress and identifying any new targets for future sessions. EMDR therapy offers hope for those suffering from trauma.